Hi, I'm Dr. Rachel Corman. I'm the feline specialist at VSS. You can probably tell from the amount of cat hair that I've got on my jacket. This short video is just to give you some information on esophagostomy tube use in cats. So what we'll run through is just the indications for the use of O tubes in cats, and then we'll show a video of how to place the tubes with an O tube being placed by Dr. Abby Tipler. The main reason that we use esophagostomy tubes in cats is predominantly to be able to provide adequate enteral nutrition and also to provide medications via the O tube as well. O tubes can be left in place for an extended period of time, and I've had cats that have had O tubes in place for months at a time, and they tolerate them incredibly well. The placement of a tube is really quite straightforward, as Dr. Tipler will demonstrate in her video. Complications tend to be infrequent, but they might include things such as infection around the stoma site, so that's the insertion side of the tube, and potentially the development of mild esophagitis or nausea in cats that might be identified through things such as regurgitation or drooling and lip smacking. Most of the time this can be addressed just through the administration of further antiemetics, and also just making sure that everybody is feeding very, very slowly through the esophagostomy tube itself. If you give the food too quickly, then that will induce nausea and vomiting in the patient.
So we have everything that we need here for an esophageal feeding tube, and we've got our cat in position, and we're going to require an assistant to basically place the forceps, some nice long curved forceps. You don't need to be too picky about which forceps you use, as long as they've got some good teeth that can grab onto your esophageal feeding tube. But basically you want to place this up into the left side of the cat's mouth and down, and just make sure that you're going into the esophagus, and then that's going to basically be levered up to the skin where we're going to make our incision. So this is our assistant placing the forceps into the esophagus. You can actually it is possible to do this procedure by yourself, but it is just a little bit easier to have an assistant who can basically be placing some counter pressure as you make your incision through the skin and into the esophagus. This cat has obviously also got a central line, so we're going to place it about midway down the neck, maybe in this cat just a slightly more caudal, just so that we're well out of the way of our central line. And this region has been sterilely prepped, but it's very difficult to do this with full drapes, so especially for demonstration purposes. Okay, so I can feel the tip of the forceps here underneath the skin. And we just want our assistant to basically push up against us absolutely as hard as they can while we incise the skin and through the esophagus onto our forceps. And then we get our assistant to push, push, push at the same time. Until our forceps come through the esophagus, and then we're going to pass them the tip of our esophageal feeding tube. And we just want to make sure that they get a really, really good grip of it at this point, and then they're going to pull it through with a bit of a yank. And the feeding tube exits the mouth. And I find that one of the most important things here is to basically pull it all the way through the mouth. And then we're going to loop back and we're going to place it back into the esophagus with our forceps. And you can generally take over at this point. And then what we want to do is we want to keep on threading this side basically back down through into the esophagus. So I just remember which side I'm pushing on. And you thread it all the way, basically as far as you can. And then I put my finger in and I give it a final push. And at the same time, we're going to pull up on the tube and it flips it over. And I really find that only works well if you pull the full length of the tube out through the mouth. Now we pre-measured this tube so that it is basically going to enter in the mid-cervical region and finish up between around about the 8th to 10th rib. And we'll confirm with a radiograph, but that's basically, we worked out about 10 centimetres from the insertion side.